The objective of this practical is use of stethoscope and measurement of human arterial blood pressure and pulse. Now we will understand the principle of this practical. Blood pressure is defined as the force exerted by the blood per unit area of vessel wall. It is the lateral pressure exerted by the moving column of blood on the walls of the systematic arteries. The normal systolic pressure ranges from 100 to 140 mm mercury. The normal diastolic pressure ranges from 60 to 89 mm mercury, and the normal blood pressure is 120 by 80 mm mercury. What are the physiological variations in blood pressure? Blood pressure increases during exercise and emotions. It decreases during sleep. It increases with old age. Blood pressure is higher in males as compared to females. What are the requirements for this practical? In order to perform this practical, you will need a sphygmomanometer, which is commonly called the BP apparatus. It consists of mercury manometer. Now look at this figure. This is mercury manometer. It is fitted in the lid of the instrument. This is the mercury reservoir, which is present at the bottom of mercury manometer. This reservoir is connected with the bag through a rubber tube, as you can see here. The second component of a sphygmomanometer is graduated tube, which is also called manometer tube. This is the manometer tube. It is calibrated in millimeter from 0 to 300, each division representing 2 millimeter. A locking lever disconnects the mercury reservoir from this manometer tube. A spring-loaded clip is present at the top of this manometer tube, which keeps it firmly pressed into a rubber washer to prevent leakage of mercury. Third component is armlet or cuffs. These cuffs consist of an inflatable rubber bag, which is enclosed in a long strip of inelastic cloth. In some cuffs, Velcron strips are provided to keep these cuffs in position. Fourth component is air pump. It is an oval-shaped rubber bulb with a one-way valve at its free end and a leak valve with a screw at the other end. The cuff inflated by turning this leak valve screw clockwise and alternately compressing and releasing the bulb. Deflation is achieved by turning this screw anti-clockwise. For this practical, you will also need a stethoscope. It consists of earpieces, a chest piece which has two end pieces, a bell and a flat diaphragm. Some stethoscopes have only the diaphragm and Third component is rubber tubing. Now look at this side. These are earpieces. When inserted, these earpieces should point forward rather than backward. They should fit snugly without causing any discomfort. This is rubber tubing. This is the chest piece. The larger side of this chest piece is called diaphragm, which is ideal for detecting breathing as well as normal heart rhythms. The smaller side of this chest piece is called bell, which is better for detecting abnormal heart sounds and bowel sounds. Aneroid sphygmomanometer is common in use. In this manometer, metal bellows, mechanical links, and a calibrated dial replace the mercury manometer. However, it should be calibrated against a mercury manometer from time to time. What is the procedure of recording blood pressure? Blood pressure can be recorded by two methods. First is direct method. In direct method of recording blood pressure, an artery is punctured with cannula which is connected to a manometer. Second is indirect method. It is further divided into two methods, palpatory method and auscultatory method. Now we will understand the procedure of palpatory method. Apply the cuff closely to upper arm. The cuff should be placed 2.5 cm above the antecubital fossa. Radial pulse is palpated while cuff is inflated till the pulsation can no longer be felt. Inflate the cuff slowly to a pressure 30 mm mercury above the normal pressure where the pulse disappears. The pressure in the cuff is then slowly released till the pulse reappears. Note the reading. This is the approximate systolic pressure. What are the advantages of palpatory method? Palpatory method is useful in shock and hypertension. What are the disadvantages of palpatory method? Diastolic pressure cannot be estimated by this method. This palpatory method lacks accuracy because the systolic pressure measured by this method is lower than the actual systolic pressure by 4 to 6 mm mercury. Now we will understand the procedure of auscultatory method. Apply the cuff to the arm 2.5 cm above the antecubital fossa. Radial or brachial pulse is palpated while cuff is inflated till the pulse can no longer be felt. Deflate the cuff and re-inflate to pressure 30 mm mercury above that level. Then stethoscope is placed on the brachial artery. Pressure in the cuff is then slowly released until a sound is heard. This is systolic pressure. Now continue to lower pressure until the sound becomes muffled and finally disappeared. This is diastolic pressure. The sounds heard in stethoscope during the estimation of blood pressure are called Korotkov sounds. What are the precautions? Patient should be mentally and physically relaxed. Expose the arm properly for measuring blood pressure. Squeeze the cuff and ensure that it is airless before applying to arm. Lower border of the cuff should be 2.5 cm above the antecubital fossa. Cuff should be wrapped around the arm evenly and firmly. If it is too loose, pressure will be low. If it is too tight, pressure will be high. 3 readings should be taken. Then write down their average. The arm with the cuff wrapped around it should be at the level of the heart to avoid the influence of gravity. The cuff pressure should never be kept high for any length of time because generalized reflex vasoconstriction may occur, which can cause discomfort. As a result, the blood pressure would increase. Here are your study questions. Why blood pressure is higher in males as compared to females? And what are some possible sources of error or variation in blood pressure measurement by auscultation?